I'm glad so many of you are able to join us on what appears to be a pretty beautiful day outside for our second session of the semester, where we're going to hear from Dr. Heather Gardiner and Amy Confair a little bit of an update on what is going on in our Office of Community Engaged Research and Practice. As many of you who have been part of our community for the last couple of years know, this office was a strategic initiative to really provide us with more resources and guidance to appropriately develop and manage our relationships with a community research partners. And Heather and the team have really done such a great job, both not only in sharing their successes with all of us, but it makes me very happy when I see the growing number of grant applications where members of her team have been brought in as consultants. They've done a lot of the formative work and so forth. And I'll just take a moment just to congratulate them yet again. The office actually just a few weeks ago, we received news, has received an AHRQ grant, which will allow them to host a meeting later on in the academic year at the intersection of obesity and kidney transplant. Many of you know that we have very robust kidney or transplant programs here at Temple, along with our expertise in obesity. And I think this is a fantastic opportunity for us to take stock of the resources that we have and begin to think about that as a platform going forward. And before I turn things over to Heather and Amy, let me just throw out two other reminders. Somewhat accidentally, next week is going to be biostat focused week. Next Friday's session, we have Reja UCL coming in to talk about issues in the biostat core, which I think is going to be a fantastic session for all of us across the faculty. But that core actually has developed their own seminar series as well. And their first event of the semester is actually on Monday. Let me just look at my calendar, make sure I get the time right. It's also on the college's calendar. It will be a session at 1 o'clock on Monday afternoon. Again, for those of you who either do your own stats or work with members of that core to interpret your statistical results, I think it'd be a great session. So I look forward to seeing you both at Monday and Friday sessions, which will have more of a biostat focus to them. So with that, I'm going to turn things over to Heather and Amy and let them tell us all about the great things that are going on in CERP and the role that they can play in supporting all of our scholarship going forward.
Thanks, David, and thanks too for sharing our AHRQ success, our win. That was a very painful process. And thanks for everybody for joining today. I hope by now, after 3 years in existence, most of you are aware that CERP exists, but I know that there are a lot of new and incoming faculty who may have talked with me during their interviews prior to joining our team as an OWL. But I did want to make sure that everybody was aware of some of the things that we have done and are doing and are planning for the upcoming year. So I want to start by sharing a little bit about, so this is our outline. I wanted to introduce our team. We have Amy Confair, who's here with me today as the Assistant Director of CERP, Kate Gallagher, who many of you knew as Director of OCPFE, and I apologize, I don't know what that acronym stands for. I butcher it every time I try. So she is now with CERP and is serving as Director of Community-Based Learning. Elise Castillo is our Department Coordinator, and Brianna Richardson, our Research Associate. And so if you see us on campus, please say hello. So our mission really is to develop and grow the college's portfolio of community engaged research and practice. So our mission has been to build capacity for equitable and mutually beneficial partnerships with our neighbors, locally, regionally, and nationally. So we do this by integrating community voice in all of our efforts, and that's exemplified by our 3 committees that help with governance and function and planning. We have an executive committee that's now comprised of, I think, 20 people from different organizations in North Philadelphia. a steering committee made up of largely faculty from CPH, but also some folks from the hospital and other units across the university, and then a public health advisory committee or council made up of lay community members who actually have served in a number of capacities, from helping provide some input on last January's advocacy summit, the Public Health Week. They served as a panel, and they are a resource to you all too for a sounding board for research and projects and practice. We also share resources and information about health and healthcare, both internally and externally. We try to really identify community strengths and assets rather than focus simply on the needs. And we facilitate efforts to get more funding. We have a set of values, so our mission, vision, and our set of values have all been developed in collaboration with the 3 committees that are part of our office. And so we really are all about partnering for health. That's really our vision. So in the last academic year, we were quite busy. Some highlights: we actually delivered 1 public health talk, and these are intended to bring our faculty expertise out into the community. So Omar Martinez and Carolina Grest, many thanks to you both, but they did a Zoom presentation for Congreso on COVID-19 in Latinx communities and the social determinants of health. Our community campus brown bag series really is much more a little more advanced. So the idea behind these series is really to present topics related to community engagement. And as one example, we did host Barbara Israel and one of her community partners who talked about CBPR 101, Community-Based Participatory Research 101. And in the spirit of kind of keeping with that tradition, last fall, Phil McCallion, Lisa Ferretti was supposed to join, but unfortunately couldn't. But he delivered a talk about their work in Albany, and it was about reimagining community campus relationships. It was a really fantastic talk, and the work that they're doing is, for me, very inspiring. In the spring, we had Denise New from PCORI talk about PCORI, and we did a bunch of things with our steering committee, and one of those was to focus on developing some do's and don'ts for PCORI submissions. I still have not been able to crack that PCORI nut, which is a little infuriating. So we're still at that. And we're also working with the Biostats Core and TUHS to develop some data management and analysis workshops that are community facing. We've also last year launched 2 surveys. The first was an internal survey of CPH faculty, and the other was one of our community partners. And this was really to get a good sense of what kind of community engagement is going on in CPH and what our community organizations think about those efforts. Last spring, we hosted with the kinesiology department and Mark Settenberg the first Give Back Day. And this is really a community service effort where an organization in the community is invited to help think about the ways that our college can help their community, their organization in some way. And last spring, we were at Bethel Presbyterian Church where we did a massive cleanup inside and out. And we helped with their community closet. So we organized some of their many, many bags and boxes of clothing. We also co-hosted Community-Driven Research Day and Research Readiness Day with the large institutions in Philadelphia like Penn, CHOP, Jefferson. I know I'm missing some, I always do. But we have 2 projects that we are supporting with community partners, one by Julia Kabluski and her team, and then another by Yara Zisman-Iliani. We also submitted 2 CPPR certificates, one at the undergrad and one at the grad level, for consideration to the, I don't know, the governing bodies that determine which certificates get approved. I really don't know where it goes, honestly. Hopefully we will have more news on whether they have been approved and when they both start. So more to come on that. We also were a part of supporting the COVID-19 vaccine clinics, both in CPH and external to CPH. And we had a number of projects that provided technical research assistance and skills training to our community partners. So at this point, I would like to turn this over to Amy Confair, who's going to share with you the results of our 2 surveys, the CPH faculty survey and the community outreach survey, after which I will end by sharing with you our plans for the upcoming academic year. So Amy, the floor is yours.
Okay. So hi everyone, I'm glad to be here. So this is the section where we're going to go through those 2 surveys that were mentioned. Sorry, one second. This is just the way that we are tracking community engagement at the college. So first off, a big thank you to the CPH leadership for valuing this work and for giving us the support to create these surveys and put them out there. Thank you to the CERP undergraduate students who helped us with some data analysis and reporting. Thanks to Sam Yellman for awesome Qualtrics support. And thanks obviously to the survey respondents for providing thoughtful feedback. So just to orient everyone a little bit, we like to give our definition of community engagement, which we have from the Carnegie Foundation. This is the definition that our office uses. And to highlight, it's really about bi-directional learning and teaching in community engagement, recognizing that everybody's an expert, either researchers are an expert of public health knowledge or research protocols, and then community members are experts of their own lived experience, of their own community. And since everyone's an expert, then everyone deserves respect and a say in decision making. So that's kind of what leads us in this work. So the first survey I'm going to talk about is what we call the CPH Community Engagement Tracker, which is the survey that hopefully a lot of you filled out either last fall or last spring. So why do we want to measure community engagement? Basically, as public health professionals and researchers, we do this all the time. We engage with community. It's what helps us do our work even better. And so it'd be really great if we can be leaders and show our prowess and our reputation for doing this at the university level and also among our peers and other colleges of public health. We also want to be able to brag about our community engagement essentially to prospective students and research partners and donors and funding agencies. As you're noticing on more and more grants, it's asking, a section on community engagement or how are you going to, engage partners. We want to grow and track our network over time. And so just having a sense of who faculty are partnered with can help us think about how CPH wants to grow our network in the future. And also see for accreditation likes to know how we're engaging with the community. So this is about essentially the survey that we created. We developed and administered a Qualtrics survey to CPH faculty, and we sent this to all faculty regardless of designation, whether tenure, non-tenure, rank, experience with community engagement. Even if you had no community engagement, we wanted you to fill this out because we had a lot of what if type of questions. We asked about community engagement specifically within the last 3 years and including any research, teaching, practice, and service. We also assessed we also assessed service learning as a distinct section of the survey. So overall, we did pretty well. We got 164 responses, and that meant 122 unique faculty completed the survey. So if you think about the rough size of our faculty, that was about a response rate of 71%. And then out of those 122 responses that we got from faculty, a few people mentioned the same organization, right? Which means faculty are partnering with the same organization for different projects. And that's how we ended up with 99 unique organizations reported in the survey. So just to give a picture of what, who filled out the survey, we had a good mix from across departments, though the majority of responses came from health and rehabilitation sciences, communication sciences and disorders, and social and behavioral sciences. I also want to note, I didn't show the chart, but about 50% of the respondents for this survey were relatively new to Temple, being affiliated with the university for 5 years or less, which also isn't that surprising considering all the recent hires. So next we basically, the main part of the survey, we asked, do you have current engagement? Do you currently or in the past 3 years engage with the community in your work? And so about 60% of our faculty reported community engagement in their work within the last 3 years. And again, this could be research, teaching, practice, or service. Next, we asked for basic information about who that organization is that they're that they're engaging with and why. So about 50% of the organizations reported on were CBOs or nonprofits. And then if you look at this chart, it was nice to see kind of a range of essentially purposes of the collaboration between research, teaching, and service. This chart was an answer to a question of what do you expect to come from this partnership? So that was, and it was a check all that apply, right? So we asked faculty, after this collaboration, do you expect to produce an academic publication? Do you expect to produce a community-facing product, either a brief or an info sheet or something of that sort? And what I would love to see eventually is for things to match a little bit, right? So if faculty are doing an academic presentation, then hopefully they're also doing a community presentation. Hopefully, if it's community-based or community engaged research, they're also giving the reported results back to the community. And same thing, so if we have an academic publication, hopefully there can be some sort of info sheet or brief or op-ed article or something in a newsletter that gives the information back to the community. It also is a way of flipping what used to happen historically in research, or what still does happen a lot of places, where researchers go in and get their information and come out and the community never hears from them again. So we really want to do better with getting results back to the community. This was after we asked about current engagement, we asked faculty, are you interested in engaging the community in your work? So of the faculty who reported no current or recent community engagement, 79% indicated desire to include community engagement in future work, which is really exciting to us, right? We included a couple quotes here so you can get a sense of what colleagues are saying about their interest in community engagement. So people want to do research and projects done by students that sites can actually use. Another person said, I would love to have students working with practitioners to do things like develop assessments or incorporate new techniques and facilities. Lastly, multiple faculty noted in this question, when asked, like, what kind of community engagement would you want to do? Multiple faculty noted that they want to involve students in the engagement. So that would be either through research or a coursework. Next, we asked people who did report current or recent community engagement, current collaborations. We asked if they had ever sought funding, if they've ever gotten funding for that collaboration. And I realized I could organize this chart a little bit better next time, but let me tell you what I pulled out from it is that if you look at it, those who had current funding or previous funding, or whoops, sorry, how do I get back? Or those who had current and previous funding, if you add up those percentages, it ends up being about 36% had some sort of funding for their collaboration that they're reporting on. But also almost 50% report that they had never even sought funding. So it means they have some sort of relationship with this organization and no funding, which might be reasonable, right? It might be that they're a board member on the organization's board, right? So that wouldn't come with funding, and that makes sense. But in general, I think there are a lot of projects out there that we could seek funding for. So out of those who did report funding, we asked about what the funding source was, and then created this chart of Almost 50% of the funding is from a national source. So that's, NIH, et cetera. The 30%, the internal funding or an organization or foundation, that's, seed funding from the college or from a department, or, a local organization funded a project, and then the state as well. On the right side of the screen, you can see there is a range of amounts of funding for this type of work. Again, there wasn't a huge amount of projects that had funding, so that's why these numbers are what they are. But just to point out, we did have the highest amount of funding reported was $4.8 million for a collaboration like this. All right, so next, we kind of flipped a little bit and talked specifically about service learning and community-based learning, and that that is community collaboration involved in a course where students are involved. So this section focuses completely on service learning, which is just one way that our faculty are engaging with organizations. So if you notice, just over 40% of faculty respondents had ever developed a course. So this means ever here, Temple, elsewhere, just had ever done a course like this. But then we asked further, and just over half were not teaching a course, but nearly 2/3 had taught a course in the past year. And so then we asked plans to teach a course like this in the following year, and almost 60% said no, that they weren't going to do this type of course in the following year. So then we asked if we had supports, if CPH develops, if CPH or essentially the university, if there are supports given to faculty dedicated to essentially teaching and supporting service learning pedagogy, would you be interested in using those? And this question was asked, I think it was asked of everyone, whether they said they were going to do this or not. So the good news here is when we asked if we had supports, would you use them? 43% of faculty said yes, 38 said maybe, and the maybes were specifically, when we asked more, they were saying, well, if it's practical, if it's tangible, if it's really specifically related to what I need to do, then yes. So if you add up those two numbers, you get 81% of faculty respondents said that they would use support if we create relevant supports. So that's a lot. And good news is that we're working on that now. So next, I just included some of the quotes from our faculty about, why they would do this and, whether they include the sports. So starting at the top, I teach predominantly in our graduate program, which is fully online. Any service components would need to be adaptable to online environments. So that was somebody who said maybe, explaining why they would use services or not. Supports to navigate the surrounding community, enable connection in various programs and services that would meet the needs of the population would be great. It would be terrific to have collaborative research and resources and dialogue. So people are interested, which is great. This is my last slide on our tracker. So this is for the kind of our conclusions and recommendations based on the information we pulled from this CPH community engagement tracker. First off, we should celebrate and highlight CPH community engagement. We are doing it a lot. A lot of people are doing really great projects. And so we need to have those reported either in the tracker or elsewhere to us so that we can help promote the work that's being done. We're going to improve the tool. Doing it once you realize how to improve your survey. So we're going to do that next year. The next thing we want to do too is we have tried to say to please pass this on to doctoral students and trainees, and that didn't happen so much this past year, but we do want to continue to try to get that information as well this year. We want to include students in community engagement. So that was definitely voiced by faculty, and I think is a really good way to think about what we can do next. We want to create service learning supports that respond specifically to the requests from the faculty. And we want to support the 80% of faculty who are not currently engaged with the community, but who want to be. And most importantly, from our office, we want to always promote equitable and respectful engagement. And what we mean by that really is centering around community assets rather than needs, coordinating asks from CPH so that we're not burdensome to the community, sustaining a relationship over time, so not going in and doing one project and then popping back out again until you need something again. And we really want to focus on compensating our community members for their contributions to our college, whether that's helping teach our students because they're interns or speaking in a class or anything like that. We want to make sure that we're compensating for them for what they're doing. And CERP can help coach on all of those sorts of things if you'd like to speak with us. We also want to develop, what was cool, interesting about the survey is we asked people to rank the status of these partnerships, whether they were established or developing or current or outdated. And so one thing that this can be used for is for all the initial partnerships, for all the things that faculty have started a conversation but haven't quite developed a real solid partnership or a funded project yet. That's something that we can build on. And yeah, and we'll just keep putting ourselves out there and making sure that everyone knows the support that we can provide as well. All right, so now I'm flipping gears to talk about our other big survey that we did last year. And to make a side point, both of these surveys are going to be repeated. We're going to try to do them annually to get information over time. This is what we call the CBO outreach survey. So this was a survey that we were using to try to assess our history and ability to engage meaningfully with community partners. And part of the reasoning for that is that interactions the community has with CPH can affect lots of things, including the success of our programs, our overall impact on public health and healthcare outcomes, and our reputation. You know, so when the community interacts with us, it really can impact a lot of things for the college. So this is about the survey again, our methods and participation. So we developed and administered a Qualtrics survey that we sent to external organizations. And our distribution list for this first round was essentially our CERP executive committee, which Dr. Gardner mentioned earlier, and also the list that OCPFE had for field placements. So we launched the survey last spring. We pretty quickly, within 4 weeks, got 123 responses from 117 unique organizations. So that discrepancy is just that we sent it to multiple people from organizations sometimes, and we asked them to coordinate and only submit one response, and that didn't always happen. Especially if you think of like a big hospital, right? Someone got it from 2 different departments, we might have gotten 2 responses, that's fine. The response rate is a little bit difficult to specifically pin down, but we sent the survey out to around 400 organizations, so the response rate probably is around a little over 25%. And as I said, we're going to try to do this annually. So here's who filled out our survey. We basically asked them to self-select what category they would call their organization. And so not surprisingly, the 3 most common were CBO nonprofits, healthcare clinics or hospitals, and then schools or education institutions, for instance, like Head Start, something like that. The caveat or disclaimer, just what I want to mention is it doesn't necessarily mean that we don't have partnerships in faith-based and religious organizations or health department or other ones listed here. It just means maybe they didn't fill out the survey. So this was, we asked the organization just to get a sense of like, you know, who this organization is. We said, what are the main services or issues that your organization handles? Was interesting. So these, I think we're gonna switch a little bit, but people really, it seemed like a lot of mental health organizations, a lot of organizations that are focused on homelessness or education. And then we also asked what are the main policy issues that your organization will focus on or has a focus on the next 5 years. And responses that these are kind of the top 4 responses. It means that organizations are focused and interested in health equity, racial equity, chronic disease prevention, and surprise, surprise, COVID-19. So I think these are all things that we want to keep in mind if we're wanting to develop partnerships with these organizations. These are issues that, you know, CPH should be focusing on as well. So the current collaboration types. This was a very long question where we asked organizations to say, well, how are you collaborating with the college? You know, in what ways are you collaborating with the college? And for these first 4, the next slide is also answers to the same question. But as you can tell, we tried to mirror it. So again, we want reciprocal, good, equal partnerships. So the first was, are people from CPH attending organization events? And then we asked, are organization people attending CPH events? We said, are CPH speakers speaking at your organization? And then, are organization staff members speaking at CPH? You get the idea. Consultation, and we talked about on the board, right? So whether CPH people are on their board versus they work on a committee for us. And so what we'd like to see is these to be mostly equal. I think, the biggest ones too, that we have action, places for improvement is right in there. And then the other answers for that question, the other things that people could select were, are you involved in a collaborative research project with someone from CPH? Was there an event or something that CPH gave donations to or did some community service at? And then how about the organization participating in CPH-led research? And so you can see how those panned out as well. Next, we had a section where we were asking the organizations about our student engagement. And as you can see, again, if you think about the distribution list, the fact that a huge part of the distribution list was the list from OCPFE of field placements, this would make sense that most of them had a student involved. And then we asked about student preparation. So this chart is about whether community-based organizations feel that our students are prepared in these following ways, in these competencies. There were a number of respondents. There are a number of respondents who said that CPH students engaged with their organization were either not prepared or partially prepared in the stated competency. So we combined not or partially to make this kind of the underprepared category. And so just so I could report these numbers. And just so you know, because the other option was people saying, oh, the students were fully prepared. In all but the last two, so that means all of these categories, people who selected under or not prepared was a higher number than those who selected fully prepared. So we have some work to do. Next, we asked open-ended questions. We asked the organizations essentially what helps facilitate collaboration with CPH, what are barriers to collaboration with CPH, and then what could improve the collaboration. And so in answering the first, what are facilitators to good collaboration with the college, we heard good communication, clear instructions, accessibility to good, competent staff, flexibility, and then similar values and goals. So that would mean the organization and CPH having similar goals. Next, barriers, lack of or inconsistent or disorganized communication. And then these middle three, unprepared interns, time-consuming, scheduling conflicts, unclear requirements or instructions. I think most of those were related to internships and fieldwork as well. And then COVID protocols and restrictions. So a bunch of these barriers in here. Also, people were mentioning things like the testing requirements, too much or too little COVID information from the college, things like that. So the how can CPH improve? Not surprisingly, better communication, right? Clear requirements and goals for the internship, improve preparation for our interns, decrease the time commitment. People are saying too much paperwork, repetitive paperwork, and connecting preceptors to other opportunities within the college. That would be like, having a preceptor come in and also do a guest lecture or offering training to our preceptors, things like that. All right, so the next kind of 4 sections of this survey, we were asking organizations, essentially saying CPH can provide this type of assistance. Do you use it? Would you use it? Are you interested? That's kind of the line of questioning we're getting into now. So the first question was about technical assistance. So essentially we said that the college provides technical assistance to organizations, and we can provide this type of technical assistance in terms of research support and access to peer-reviewed literature, collaborating on grants, doing evaluations, health promotion campaigns, some data management and analysis, and events. We said, has your organization used this within the last 3 years? By far, most people do not know that we even do this. That's kind of the conclusion from that. Then we asked, well, if you were interested in this type of assistance, what could CPH do? What would you be interested in? And I like to point out that one of the really great side benefits of doing a survey like this is we get to tell people what we can offer and what we do. So just by reading the questions, they're like, oh, CPH does that. That's really neat. So this question was a check all that apply. That's why the numbers don't add up to 111, just FYI. But out of 111 respondents, 54 people requested access to peer-reviewed journals, 49 requested access to temples, libraries, and so on. They want access to our events, health promotion and communications and needs assessment help as well. All right, so the next question in this section we're asking about what we offer and would they utilize it, is about trainings. So we asked, if anyone from their organization had attended a training within the last 3 years. About 69% of respondents said that they had not utilized a training or were not even aware that we offered trainings. 86% of respondents, so 91 people, said that their organization would be interested in attending future trainings. So we just have to get the word out there when we're doing trainings that could be available to community partners, and that's something that CERP can really help with as well. Then we asked, if you're interested in future training, what type of training, would you like the college to provide? The biggest response was community engaged research and CBPR. Next was grant writing, utilizing programmatic data collection, any support around data analysis, research methods and processes, and then other, and people had specific asks. Again, this was a check all that apply question. Next, the next question kind of in this line of questionings was service learning opportunities. So we described what we mean by service learning, and we said, is this something you've been a part of? Again, most were not aware that this is something we do, but when asked if you would be interested in doing this, 72% of organizations said they would be. So that gives us a lot of opportunity to develop service learning programs. The last one of this section was biostatistics support. So we have our great biostatistics core. Let's make sure that our community partners can benefit from that as well. We asked, have you used any services in terms of biostat support from the college? Again, most were not aware that we do this, but when we asked interest in future support, 47% said yes, they would be interested in some kind of support in this way. Okay, so that's the end of the talking about that survey, so talking about the engagement survey with community partners.
Thanks, Amy.
Yep.
So I think really what this tells me is that we're doing a really great job, but there is some room for improvement. And we have some ideas for what we in CERP can do to help fill that gap in the coming year. So what we have planned for 2021 and 2022 are 2 library resource guides. One is just about done. This is one on community engaged research. And this will be made available very shortly. We'll have lots of resources available to you and will be linked out through the CERP website and on the university's library webpage. We're also currently working on a library resource guide for service learning. So both of those will be forthcoming. We also have some interviews happening currently. So we, over the last last spring and in the summer, we conducted interviews with faculty and some community partners about their work with community engagement and CBPR. These are going to really highlight the work that's been going on in the college and in the community. So these will be available on our website shortly. We're in the process of editing them now. If anybody's interested in being interviewed, please let us know. We're always looking for faculty who are doing this work to be part of these kind of spotlights, highlighting what you have going on. And then the further plans in the spring, we'll be launching CBPR 1 at the undergraduate level. So this is listed under SBS, but it is intended to be an interprofessional course. So all are welcome to take it. It's an elective. We have hopefully 2 upcoming public health talk series. Another one with Congreso de Latinos Unidos, and I butcher that every time I say it, so apologies. But they have actually asked for us to have somebody talk about trauma-informed care, and Esperanza Health has asked for us to come back to. I guess I didn't share this, but our first public health talk series was David Sarwer going to Esperanza's senior group and talking about obesity. And then we have followed that up with the Young Mudo Hapkido Club doing some self-defense training with that group. We have 2 community campus brown bags planned. One this fall with Whitney Caby. She's an emergency doc and part of our steering committee. And then Charles Rogers from the University of Utah will be joining us in the spring, hopefully in person, assuming that all goes well and we can actually bring him to campus and be in person. But he does a lot of work with barbershops that are community engaged, and we're really looking forward to hearing about his work. We also have some community-based learning supports, so service learning supports. Kate is working on a proposal to provide some more training to our students before they go out into the community. And we will be available, she and us will be available to chat if you would like to do some service learning in your class, whether that's just a component of the class or designing like a proper soup to nuts service learning course. We're also planning for our next Give Back Day. You probably have heard about this in your department meetings. We were looking for representation from all of the departments to be part of this. And we are working with the Alumni Association as well to combine efforts to really demonstrate our commitment to our North Philadelphia neighbors. So this is bringing us out into the community to do some sort of volunteer work or service for community organizations. And hopefully this becomes a CPH tradition that is longstanding going forward. Really love to see that. We have community-driven research day coming up at the end of this semester. And this is longstanding, 11 years now, 12 years. We're in our 11th year. Amy actually has been on this committee for a very long time. If you're not familiar with Community-Driven Research Day, this event invites community organizations to present on their organization, the mission, the vision, and some questions that they have need for research help in answering. So they are the presenters and we are the attendees. And it's a nice way to make connections with community organizations and start new collaborations. In the spring, we're also working with the Beitul El Fayed Mosque and the National Kidney Foundation to host a health fair. We're working with Rajai and his team in the Biostats Core to put on some data management and analysis workshops. And we will have those community engagement surveys. And through all of this, what is really underlying everything that we do is supporting faculty. So if you have need of some community engagement supports, please don't hesitate to reach out. We've done everything from just chat with you about how you might incorporate engagement into the work that you're doing, to providing letters of support for grant applications, to even being written in as consultants or co-investigators or whatever. So we are really always open to coffee and chat, but we're also here really in service to you. So we're kind of always changing in what we do, and we just want to be able to provide the support needed for you to do the great work that you've been doing. And that's about it for CERP. Thank you. Any questions?
So Heather, as the questions begin to populate, can you go back one slide? I just want to make a couple of comments, and it actually will stall for time as the questions come in. So first of all, I stumbled across those slides for that Esperanza Health Talk, and I had forgotten that we had them translated into Spanish. And so for those of you, for those of you who have never given a formal talk with a translator live, it was actually quite the experience to take slides that you know well and that you've maybe used in multiple different locations and then have a Spanish version right behind it. And I do have to say, in some ways, it was one of the most enjoyable and rewarding talks I've ever given in my career. And so for any of you who work with Spanish-speaking populations, if you've never done that before, or you're interested in taking your work out to a location like Esperanza, I'd really encourage you to think about it, because I think not only is it a great way to connect with the community and share our knowledge with them, but I think you as a presenter will learn a lot about your own presentation skills and working with people. I also just briefly want to highlight the Give Back Day stuff. As somebody who lives way out in the suburbs who has a long commute, one of the things that kind of, I guess, a regret that I have is that I'm not on campus and around in the neighborhood as much as others. And I am so thrilled that you're taking on this initiative and that people are jumping in and volunteering their time, because I think it's just a wonderful way for us to connect with our community partners in kind of slightly different ways and yet very important ways. Because I think, as we all know, sometimes our relationships are and elements of trust and relationship aren't just built in situations like this. They're built over the cup of coffee. They're built over over a shared task, like cleaning up a park or some of the things that you've done. And so I think it's a really wonderful initiative, and hope that many of our faculty and students really jump on in and participate. And then I guess the last thing I would just say is I'm thrilled to hear your interest in pursuing PCORI and talking to people. Matt Hall, who I know is on the call right now, is working on an LOI for PCORI, and we were talking about it in a meeting earlier this morning, and I wouldn't be surprised if he's reaching out to all of you. But with that, let me just again congratulate you on all the success of this initiative. It's fantastic to see the update and think about how we've taken this from the fledgling idea of 4.5 years ago and realize, to kind of see it really blossom the way that it has, and all the wonderful tentacles that you have involved. And so it looks like we finally do have a question coming in, because if not, I was going to be forced to start singing show tunes, which really nobody wants to hear. So let me turn things over to you and let you moderate. And right on cue, Matt has that first question. So I'll let you guys take it from there.
Thank you. And thanks, Matt, for the question. So he asks or says, community-based organizations reach out and ask if I can give a presentation or some other low-level engagement. Do you have recommendations about opportunities to leverage these opportunities as a first step toward more substantial engagement? Yes, I actually do. So that's a really great entree into the organization. And I've had a few folks ask how to get the relationships started. And I love to start them. And this isn't what I've always done. I've actually mucked things up royally in the past, but I look at this as how you develop a friendship. So if you invite them out to coffee, lunch, whatever, and do an informal interview about their mission, their vision, what work they have going on, and kind of what their needs are, that's a good way to kind of get to know the organization. And then you can share the things that you do. But if you make it really informal and just sort of a get to know you interaction, that's a good place to start. And then I would advise you to be present in the organization, either on their board or as a volunteer, and really show that you have a commitment to being there and start developing a relationship of trust. So they start really seeing that you are committed to their cause and to helping out in some way. It takes a lot of time, but I find it to be rather enjoyable to do this kind of stuff. And one I haven't talked about, one of the initiatives that I have personally this year is to make some changes, hopefully institutionally, in terms of P&T and how this work is recognized. So this is new to David too. You see the look on his face. But I would really like to see greater appreciation for the time that it takes to really establish a trusting, mutually beneficial relationship with organizations. And that work needs to be done before you actually ask for their partnership. Ideally, that is the best way to approach it. I hope that's helpful. If not, let us know and we'll grab coffee and chat. Jingwei says, it asks if the presentation today is recorded. I believe that it is being recorded and it will likely be on our YouTube channel. I don't know, but it'll be somewhere and we can share instructions on how to access that later.
And Heather, I just threw a question in the chat to you, but I'll just ask it. You know, obviously you guys were wonderful in terms of putting together that Veterans Affair panel that we hosted back in August, and we're going to create. And what is the kind of bandwidth right now of CERP to create and facilitate other specialized community participant advisory boards?
That's a great question. So it's not something that I actually shared today, but we've done it for more than just our CPH Veterans Advisory Panel. There were a bunch of folks that were looking to put in proposals around HIV last 2 years ago, maybe, I don't know. And they really wanted to have the proposal informed by the people doing the work, so community organizations and individuals that are living with HIV. So we worked to pull together a group of folks to have an initial meeting. I don't know honestly what came out of that effort, but that's certainly something that we can help with. And now that it's more than just me in the office, we have more bandwidth to help with these things. Yeah.
Yeah, and I think your point about both starting those sessions, you know, those types of meetings early and putting in the energy to build that sense of trust is critically important. You know, as somebody who's reviewed grants that have had these elements in them, you can kind of tell who's done the legwork and who's kind of doing some hand waving. You know, to say that you assembled a community advisory board a month before the grant went in, you know, people who know this area far better than I would say, that's a gesture. That's not really a relationship. And, you know, the strongest grants are going to be ones that go beyond the hand waving and the letters of support that say, oh, wouldn't this be great and wonderful, and we all enjoy each other's company, but actually you can tell have a little bit more of the proverbial meat on the bone to them. So I completely echo that. Looks like another question's come in.
Yes. So Julia asked, do you have any thoughts about the role of CERP in program evaluation? Are requests from community agencies for support in evaluation activities something that is within our mission? Yes, absolutely. So that's part of the technical research assistance that we provide. And so what we have done for some organizations has ranged from helping design a survey or, you know, a data collection instrument that could be used for evaluation purposes to actually designing, you know, a small pilot study. So as example, the Weekly Fight, which is an organization that serves veterans and emergency service personnel, asked for some assistance in kind of generating data in that hopefully would be in support of their programming and help them get some funding. And while we were unable to launch before COVID hit, we had designed and along with some of our faculty, a small pilot that actually would generate that data. So we can help with data analysis, with getting them set up, with data management. We can also get them access to some of Temple's resources. like SPSS if they need that. But that is part of our mission. And we're happy to talk about requests that come your way for this kind of work. And that's why we have a research associate.
Yeah, I was gonna say, do you want me to give the example from Lucy Outreach?
Oh, sure. Yeah.
As well? Okay, so this last spring, and another kind of example of doing this, Lucy Outreach is an organization in Camden, New Jersey, who was connected to Lori Friedman, a faculty member in CPH, and she then connected them with us, and we kind of worked together. But basically, it's a youth serving organization. They had some surveys that they were doing, and they just needed someone to help figure out if the surveys were collecting what they needed, and you know, essentially, how do we get the information that we need to put in our grants to get funding for our organization. So Lori and I met with them a handful of times. You know, we set up Zooms, we like looked at their surveys, did some critique of actual questions, and then at maybe the second meeting they said, can you just do a training for our staff on this? And so we did essentially a capacity building training. It was a 1 hour part of their like staff development day, where I just went over the basics of evaluation, how these questions are designed, and the importance of you know, designing evaluation surveys in a certain way, and no double-barreled questions, and kind of the basics. And so that, you know, I know they appreciate it, and they'll come back again.
And just to kind of round this discussion out, so the biostat score is intending to provide some workshops on just these things as well. So in addition to having some community-facing programming around data management and analysis, survey development, what else? Something else, GIS, other topics that are related to biostats. They're also planning to have 1 day a month dedicated to providing some support to community organizations around evaluation and statistics. So that is going to be forthcoming, and something that you can share with your organizational partners as a service that we provide. I don't see any more questions. So I'm going to thank you all for listening and learning about all the things that CERP is doing and the ways that we might be able to support you in your work. And David, I don't know if you want to close out with a reminder for any upcoming sessions, but
well, Heather, thank you for not only a great presentation, but for that reminder that I should make a reminder. So as I said at the very beginning, for those of you who weren't on quite yet, we have 2 sessions next week dedicated to biostatistics and our biostat core. So Dr. Reja UCL, who joined us right in the middle of the earliest days of the pandemic, and so I assume many of you have not met yet, but has done a wonderful job of integrating with our community, is not only going to present to this group next Friday at 1 o'clock, but the biostats core is also having their own seminar series throughout the fall semester, where both Rejai and Jingwei and Levent will be presenting on a variety of different topics. And I think that for those of you who either still do your own stats or somewhere between doing your own stats and asking for help, and those of us like me who rely on those with a much greater depth of expertise to do their statistics, I think these sessions are going to be a wonderful addition to our scholarly programming this semester. So I look forward to seeing all of you Monday at 1 and then next Friday at 1 o'clock as well. Until then, enjoy the beautiful weather this weekend, stay safe and healthy, and we will see you all next week.